Okay, so this is Emily Chambers. This is my video presentation. Here's my audience, Ashley Kemble. We'll get started. Okay, so my video presentation is on the shoulder joint. We're going to be talking about the structural components, movement capabilities, common injuries, and exercises that are specific to the shoulder. Joints. Joints exist where two or more bones articulate. They allow for movement and provide mechanical support for the body. They can be classified functionally and structurally. Functionally is classified by the degree of mobility the joint allows, and structurally classified is based on the bony regions that separate the joint. The shoulder joint. It's also referred to as the glenohumeral joint. Exists where the head and the humerus articulate with the glenoid cavity. So the head of the humerus is your long arm bone, and it articulates with the humerus of the shoulder. The glenoid cavity is very shallow and comes into very little contact with the round head of the humerus. About 1/3 of the head of the humerus actually stays in contact with the glenoid cavity. This limited interface with the humerus and scapula allows for an increased range of motion with the shoulder. So here you can see that the small articulation between the head of the humerus and the glenoid cavity. Like I said, it's only about 1/3, and this is why we have such great range of motion with the shoulder. So functionally, the shoulder joint is considered a diarthrosis, or a freely movable joint. Another example would be the hip joint. It's classified as a ball and socket joint. This is because of the great range of movement along all the axes of movement. Okay, so movement. So this multi-axial joint allows for movement in all axes. This includes adduction, so moving away from the midline, adduction, moving towards the midline. Flexion reduces the angle between the articulating elements. Circumduction, so this is moving your arm in a loop, and rotation. Structurally. So structurally, this joint is classified as freely movable joint or synovial joint. Synovial joints exist where articulating bones are separated by a joint cavity containing synovial fluid. Synovial fluid acts to reduce friction between articulating joints. It absorbs shock, and it is involved in nutrient and waste removal. Synovial joints have several distinguishing features. They include articulating cartilage, fibrous articular capsule, joint cavity, reinforcing ligaments, and bursae. So articular surfaces. The head of the humerus and the shallow glenoid fossa are both covered by articular cartilages. These separate the bony surfaces and act to reduce friction. The glenoid labrum is a ring of dense connective tissues attached to the inside of the glenoid cavity by fibrous cartilage. This tissue acts to deepen the socket for attachment of the head of the humerus. It also acts as a detachment site for the glenohumeral ligaments of the bicep brachii muscles. So the articular capsule is a thin, loose, fibrous capsule that attaches medially to the glenoid fossa and laterally to the neck of the humerus. This capsule contributes to extensive range of motion with the shoulder. It's weakest at its inferior surface and when in anatomical position, so it's standing like this. The capsule is tight superiorly and loose inferiorly and anteriorly. So here we have a picture of the articulating head of the humerus and the glenoid fossa. Wrapped around is the articular capsule, and then attached to the glenoid fossa is the glenoid labrum. And you can see that it lips over, and this is how it makes the articulating surface bigger. So ligaments associated with the shoulder joint. Because the capsule enclosing the shoulder joint is so loose, the majority of the stability comes from glenohumeral ligaments. Attachment and location of these ligaments are easily identified by the breakdown of their name. So we'll start with the coracohumeral ligament. So this originates at the base of the coracoid process. The coracoid process is that hook that comes off of your scapula. It's anterior and superior to the scapula, facing forward, and inserts on the head of the humerus. It is a strong, broad band that strengthens the superior part of the capsule. And here we'll show you a picture of that one. So that was the coracohumeral. So that goes from the coracoid to the head of the humerus, so right here. There, okay. Then we have the acromioclavicular ligament. This attaches to the coracoid process and the acromion of the scapula. The acromion is another bony process that comes off the scapula. It is a little posterior. This provides additional support to the superior surface of the capsule. The acromion clavicular ligament attaches to the acromion and to the clavicle. It helps restrict movement of the clavicle. The coracoid clavicular ligament attaches from the coracoid process to the clavicle. It helps limit motion between the clavicle and scapula. And finally, we have the transverse humeral ligament, passing from the lesser to the greater tuberosity of the humerus. This creates a canal in the intertubercular groove that holds down the tendon of the long bicep brachii tendon. Okay, so here we have the transverse. So that was going from the lesser to the greater trochanter of the head. So it's actually quite a short ligament. Here we have the coracoacromial, which goes from the coracoid process to the acromion. And then we have the acromioclavicular, which goes from the acromion process to the clavicle. Okay, bursae. Bursae are fat or flat fibrous sacs containing a small amount of synovial fluid. They're found within the synovial membrane where large muscles and tendons pass across a joint capsule. They act to function to reduce friction during activity. So here we can see all the different types associated with the shoulder joint. The subcoracoid, subclavicular, subdeltoid, and the subacromial. All the names, once again, kind of really reveal where they are in the shoulder joint. So skeletal muscles and tendons. The muscles originating from the trunk, pectoral girdle, and humerus, all form the rotator's cuff, provide more stability for the shoulder joint than ligaments and capsule combined. Tendons wrap across the joint to limit movement range and aid in reinforcing the capsule. Okay, do you have any ideas what common injuries are associated with the shoulder joint?
I would say dislocated shoulder, clavicular breaks, torn ligaments or tendons.
Fantastic answer, fantastic. Two common injuries are shoulder dislocations and glenoid labrum tears. The shoulder joint is a good example of the sacrifice between strength and stability for increased mobility. The glenohumeral joint dislocation. So it's described clinically as being anterior or posterior, posterior being more rare. It's caused by an excessive extension and lateral rotation of the humerus, resulting in the displacement of the humerus head from the glenoid cavity. Subluxation is a partial dislocation. Often occurs when people are double jointed or naturally lax joints. Although the inside of the joint has no pain receptors, sensitive nerves monitor the ligament, capsule, and tendons, making dislocations very painful. Here we have two pictures, not associated with one another, of a dislocated shoulder. You can see the obvious droop, you can see the acromion process kind of sticking out a little bit more. And then in the x-ray you can actually see the head of the humerus and the glenoid cavity actually not articulating anymore. So it's pretty clear to see when someone has dislocated their shoulder. So a glenoid labrum tear. This commonly occurs in athletes involved in baseball and football. It results from the sudden contraction of the biceps or forceful subluxation of the humeral head over the glenoid labrum. Symptoms commonly associated with this injury is pain during acceleration phase or a popping or snapping sensation during adduction and lateral rotation of the arm. Okay, so some exercises you can perform for the shoulder joint include resistant band training. Often today it's used in rehabilitation purposes, but can also be an effective training tool for the stabilizer muscles of the shoulder joint. With bands and tubings, you can perform exercises that mimic sport-specific movement. They provide resistance training in all directions, no reliance on gravity as with weights. And they target muscle fibers involved in maximum range of motion. So here I have two examples of shoulder exercises. So the first one is an external rotation. So you're going to start with your arm by your side, elbow at a 90-degree angle, and your resistance band is going to be tied to a door or some kind of frame where it's lateral to your body. And just starting in this position, you're going to rotate to about a 45-degree angle and then ease it back into that same position. The second is an internal rotation. It's pretty much the first exercise flipped around. So instead of starting here, you're going to start here. Your band is going to be going out to the door again, and you're going to be starting at a 45 and pulling it in towards your body. The number of sets and reps that you perform are dependent on what you're trying to achieve. And bands come in a variety of strengths and resistances, so depending on what you're training, you have a different band for different things. So in conclusion, the unique articulation of the head of the humerus and the glenoid cavity allows for the shoulder joint to have the greatest range of motion of any joints in the human body. An increased mobility also means a decrease in strength and stability, making it fundamentally important to properly train and strengthen the supporting ligaments and muscles. So do you have any questions?
No, but I learned a lot.
Okay. And here's my references. This was my presentation on the shoulder joint.
Very good.